Hello, everybody. This is Elijah Desmond. I am your host today with the Backstage Pass, and we have with us today the one, the only, the amazing Dr. Dar Radfar. How you doing, Dar?
Hey Elijah, thanks for having me on.
Absolutely happy to have you. Listen, Dar, before we get into what you do, like the business of you, it actually really relates to the business. But can you bring me back to little Dar on the pony or the horse when you came? Take me back to Dar at size three shoes.
Yeah, everyone has, a lot of people have some childhood trauma that they always try to get over. Mine, I don't try to play victim to it. I try to use it as motivation and energy. When I was 6 years old, I escaped my country, Iran, into Turkey through the mountains of Iran on horseback. And in the middle of the night, I was riding with a Kurdish man who was helping us escape. And he kept telling me, hey, little kid, don't pee on me. If you need to pee, let me know. I'll get you off the horse and you could go pee. And the other thing he said was, don't fall asleep. If you fall asleep, you're going to fall off the horse. You're going to fall off the mountain and die. So sleep's kind of been resonating in my head since I was a little kid. I've always slept with one eye open, always looking to see where the exit signs are. When I get into an establishment or a concert or a show, I'm always very careful, very protective of my people, including myself. And unfortunately, fast forward to 2009, I did fall asleep at the wheel. I crashed my car into a tree. Later, figuring out that, hey, I got sleep apnea through a home sleep study, and they gave me a mask. I couldn't wear it. 70% of patients can't wear it. And then I realized there's a mouthpiece out there, so I became patient zero at my practice. And since then, I've used that story and my experience to really help people sleep better because I was, feeling tired and all that good stuff. So, yeah, very happy to have experienced something that was a negative and turn it into a positive.
That's awesome. And now you are literally speaking all over the country. Really, I should say all over the world, but you're speaking all over the country and you're teaching dentists, about sleep apnea. And you offer, as a coach, you offer a program to support these dentists. Can you give us kind of a high level of what your specific offer is and who is the ideal avatar? So are you like a dentist that doesn't do sleep apnea at all and you want to start and bring revenue in? Give us a kind of a high level and then we'll dive into some deeper questions.
Yeah, so I started doing sleep in 2010 for my patients myself, and I learned a lot of things on my own. In 2014, I started teaching it, and people would come to my weekend course, and then on Monday go back, and some would implement, a lot wouldn't. The pain points were home sleep studies, medical billing, making sure your staff is trained. Staff couldn't make it to the weekend course, so I solved all for that a few years ago through my RAD coaching program. Because I believe that you can't just get trained and be on your own and do it. There has to be some accountability, some coaching, some guidance, some troubleshooting. So that's what I do is I teach other dentists, general dentists, orthodontists, including periodontists that want to incorporate the treatment of sleep apnea into their practices and have their home sleep testing taken care of so there's no equipment to buy. And have a company to do their medical billing that only charges the dentist if the dentist got paid. So you got nothing to lose to have the medical billing company have that exclusive deal with them. You have to have that medical billing company bill for you and have the training for hygienists, the team. So they're top of mind. There's internal emails that are given for internal marketing for patients. There's external marketing available. It's a turnkey system. And through the one-on-one coaching calls that I have with my doctors, it's basically fail-proof. And I guarantee the work that I do, because ultimately, if I can help you, the dentist, treat people within your practice, I've paid it forward and helped hopefully thousands of people in this country and across the world get treated for sleep apnea.
That's awesome. Dar, can you tell everybody what percentage of your dental, I know you have two dental practices, but what percentage of your practices for you, like your production, are you doing with sleep? And how much are you generating monthly using your system with sleep apnea specifically?
Yeah, so I'm also, a general dentist. I place implants. I do clear aligners. I see recalls and crowns, and I mill in my own office and all that. I'm now down to 6 days a month of practice. I used to, work 3.5, 4 days a week. But now that I'm doing this coaching and consulting more full time and only practicing 6 days a week, My revenue is about 40% of my practice is sleep. So I'm doing anywhere between 8 on the low end this past year in 2025 to the high end was 42 appliances in 1 month. And on average, I would say we do about 20 to 25 appliances. Now, sure, we screen our own patients, new patients, everybody who comes in. We ask about sleep. We look at the red flags: large scallop tongue, grinding of the teeth, lower anterior wear, acid reflux, then the medical red flags such as high blood pressure, history of heart attack, stroke, arrhythmias, type 2 diabetes. Again, all these things we look at, and then we have the conversation with the patient. And then we have the seamless system of referring it to the home sleep testing company. So they do it for the dentist for me. I stand back, I wait for the results, emailed to me and to my team, and then we go over it with the patient. So on average, I would say half of the 20 to 25 per month are from patients referrals within the practice or new patients that come in, because I've already pretty much cleaned up all my existing patients over the years. And then the other half are through medical doctor referrals. And that's one of the things I take, into major consideration is how can we get medical doctors to refer within the community? And that I have a proven system that costs you nothing, just a little bit of time to be able to get the MDs referring to you.
Wow, that's awesome. It sounds like you have a bulletproof system. I'm curious. I have sleep apnea myself. I use a CPAP. I made the mistake of using a sleep appliance and not using the thing that resets it. What is that called? The
AM aligner or morning repositioner.
morning repositioner. So I didn't wear the morning repositioner, and so that's my fault. But just curious, when patients are coming in, are you primarily treating patients that have already been diagnosed with sleep apnea and giving them an appliance, or are you doing a CPAP? And can you give me the little high level on that?
Yeah, absolutely. So 5 years ago, the answer would be most patients need a home sleep study to even go forward and see what's going on there. We see the red flags, and then we talk to the patient, or they're coming in because they heard that the appliance I gave their friend stopped their snoring, so another wife is referring their husband's friend and all this other stuff. So nowadays, there's so many people who've had sleep studies and they can't wear their CPAP. Again, close to about 70% of patients who get the CPAP, those ain't even patients who've been diagnosed, don't like their machine. So the MDs know this. Their sleep doctors know this. The cardiologists know this. The primary care know this, that they're not tolerating or they're not being compliant with the CPAP. That's low-hanging fruit for a dentist that knows how to do this, for them to get the referral. So they're walking in, sleep study in hand, excited to get treated. I mean, the closing rate is over 85%. Just because it's just talking about the financials. And I make financials real easy. On average, the appliance in this country is about $2,500 to $3,000 cash fee. So I recommend to the docs, if they can't afford the whole thing up front, do 500 down, 500 a month with a credit card on file. You got 4 or 5 more payments. And it's so, easy to be able to do. It's not hurting your back, your neck. Some of the other things we do in dentistry, right? Cleanings and extractions and implant placement and all that. You see the patient 3 to 4 times, and they love you for helping them reduce their snoring and getting their sleep better. So, the system is there for patients who need sleep studies. And again, you don't have to buy any equipment. It's already done for you with what I've set up. And then also for the ones who've had their sleep study, can't wear a CPAP machine, or they're too mild to even try one. And now they're going to find you through their MD and through some of the marketing campaign that I put together, so that they can recognize you're the #1 person to go to within your community.
Awesome. And did you ever see a situation where a patient gets a CPAP and use an appliance? Is that ever a situation, or what's percentage of that, or maybe just a CPAP and not an appliance? Can you give us a little bit of detail on that?
Yeah, sometimes the patient's severe, and I go, hey, Mike, you need to go try the CPAP, and they go and they love it, and they're good to go. They're off sailing into the sunset with their CPAP machine. And so we do a lot of things in dentistry, refer for endo, refer for OS, things that we don't necessarily keep in house, because it's out of our expertise, or they could be served better by a specialist. That's the same thing with severe sleep apnea patients. When that sleep study says that they stop breathing 30 or more times an hour, it's a good idea for them to at least go try it. Now, not all of them do that. I still help patients who are severe with an oral appliance, but our expectation isn't there to be able to get them to a healthy condition all the time when they're severe. Now, combination therapy, if they're really severe, that mask is, at the highest level, and that air pressure is really uncomfortable to tolerate. We could use a mouthpiece and the CPAP so that air pressure is dialed in to maybe half of what they really need without a mouthpiece. That gives them a little bit more opening in the mouth, a little bit less air going in, so it's more comfortable to tolerate. It's like sticking your head out the window going 80 miles an hour or 30 miles an hour, right? What's more easier to tolerate with the air hitting you? So it is possible to do combination. I would say less than about 5% of my patients are combination therapy, but I got a lot of patients who have CPAP and they want an appliance for travel. They're like, I don't care what my apnea is, I just can't tolerate taking this on the plane, or when I take it, to vacation, a cabin that doesn't have outlets or a camping or anything like that. They want to be able to make sure they have something that's portable and easy to use. And the oral appliance, you could do that on an airplane. You could do that while you're camping. So they do use it as an adjunct to a CPAP if they already love their CPAP machine.
That's awesome. Now, you said something that stood out, and I think a lot of people heard it, and you kind of flew by it. Here's what you said. You said, I practice 6 days a month. Do you feel that sleep apnea incorporating into your practice has allowed you to have the life that you want? I know that you're back and forth between Miami and California, so I'd love to hear a little bit about that for the dentists who are like, ooh, this is something that will allow me to practice less and do what I love.
Man, the financial freedom has been unbelievable. Sure, saving lives, saving relationships, having wives or husbands come in that I've never met, give me a hug because they're so happy that their bed partner, isn't keeping them up. What are the ramifications on their health? Because they're waking up, a few times in the middle of the night, hearing their partner, or they got to elbow them. So all these things, doing this there's a definite return on life, so to speak, as you and I, Elijah, talk about. But the return on investment, man, I mean, the appliances cost about $450. I use Gergen Ortho Lab currently to do a lot of my appliances for a sleep herbst appliance. And we're getting about 3,000 on average. So the ROI is about 7-to-1 return. It's not like Invisalign where you're paying 1,800 and you're, billing out, doing 5,000 and you're seeing the patient for a year to 2 years. This is pretty quick. So there's a huge ROI. So what that does for me, gives me the freedom to come to Miami and do podcasts and talk to my clients. And I love the energy here in Miami. I also do it, of course, in LA where my practices are. But now I have an associate that's there full time, and he's doing the, younger associate, he's out like 7 or 8 years. He's doing the implants, the bridges, the extractions. I still do those, but it's a lot easier for me to do sleep. I haven't told many people this, but I'm starting to get neck issues. 23 years of seeing patients, 30 patients a day sometimes. My C1, C2 is collapsing. C3 to C7 on a airway CT scan of myself when I got my CT machine is arthritic. And so your back, your neck, you can only put it so many miles on the car that it's called your body. So, and sleep is a way to still see patients, still make a ton of money, now be able to have your associate or another doctor to do the work that does physically require a little bit more, a lot more, and give you a lot more financial freedom to be able to, do the other things that you're passionate about. For me, it's speaking at conferences and coaching other dentists all across the world on how to do this.
That's awesome. So Dar, we have this amazing community as a part of Backstage, the Backstage Pass website, and I just want to hear from you. Like, how has it been having another community of dental entrepreneurs that actually truly care about what you're doing? How's it been being in Backstage with the community of entrepreneurs?
So I've been a Backstage member for almost 2 years as of the recording here, and the friendships are amazing. That's just unreal. There's absolutely no ego. Everybody wants to see each other win. And what that truly means is I can lean on someone. So I have products as well. I have products for sleep, for TMJ, through my Rad Health products. I have 11 different products now, and these products are supported by Backstage members. When they like a product, they refer it to other doctors. One of the members, Ian Miller, and I are working together with my Rad Fresh. So a lot of things can happen that are positive. when it comes to being in this network. It's not just a friendship and a connection on when you can call someone with any questions that you have that's kind of within dentistry, but out of your expertise. But they also help support and grow my business. I've had you and a ton of people on Facebook groups when they see me post something about I can treat or I can help you with sleep apnea and incorporate into your practice. And people are like, yeah, man, Dar's great because you've seen my clients be happy with it. And so that support is amazing.
That's awesome. And I think a big picture thing for me is, dentists are listening to this. You look through the podcast, you look at all of the members of the Backstage Pass, and you almost can look at everybody as a consultant, right? Because like, let's just say, for example, you're working with a lab, and that lab that you're working with, they're helping you with so many ways to grow your practice. Why? Because they're tapped into, like, 50 plus dental entrepreneurs, and everybody can help you. So we're really coming together for the better part of this for dentistry. It's all come together and to serve dental practices better and to have, make sure that they have all of the resources that they need. So it's been a pleasure having you. It's awesome to watch you soar and watch you on stage and watch you to grow and help serve so many dentists in this industry. I've got to witness it right before my eyes. I remember it felt like yesterday, and we were in Nashville, 2022. And I remember you passing me with this, this is crazy good energy. I'm like, gosh, I need to get around him more often. I need to have that energy in my life. So it's been awesome to have you a part of the community and to watch you serve so many dentists. So kudos to you. I want to give you your flowers, for everybody to see. You're a great person. You're a great individual. You're somebody that everybody wants to be around. And you're really, I feel like you're a no risk type of person. Like, somebody works with you, there's no risk, right? You can feel safe if you're working with Dar. So super appreciate you, my friend. How can people get in touch with you if they're interested in learning more about your services?
Yeah, so my last name is Radfar, but I go by Dr. Rad for those of you that don't know. So drrad.net, drrad.net is my website. That'll be able to give you a booking call so we can chat about your practice to see how we can incorporate the treatment of sleep apnea and snoring, and also TMD. I do a lot of cool things with Botox training and also low-level laser therapy, stuff that's revolutionized dentistry as we speak. I speak about it on stages. You'll be able to see, what conference I'm speaking at next. And Elijah, I got to give you props. You've kind of really pushed me in the speaking world. I was a big time, scared to go on stage back in the day when I was a kid, English being my fourth language. And you gave me an opportunity to get on stage on Dentistry's Got Talent. We did Dykema together back in 2024, August of 2024. I think there was 19 of us, 19 contestants. And I was blessed to have people vote me for #1 for winning that contest and having my big belt that you gave me, which was super fun, and walking around Dykema and people are like, man, who's this guy? And since then, it's been a year and a few months. I've not only been on huge stages like the California Dental Association and so many other associations. Now I'm going to be at Florida. I have a 2-day event in California. I'll be at Yankee, so many different dental societies. And I'm doing a webinar at least a couple times a month for different groups as well to talk about my passion, which is helping people sleep better. Man, what a powerful thing is to be able to, express your message on stage and have doctors get excited to do something super, super cool and different in their practices.
Absolutely. Absolutely. Well, awesome. Well, for anybody who's looking to level up their office with sleep apnea and with Dar, and man, if there's any meeting planners that are out there looking as well, I encourage you to check out Dar and then also to check out his products. So thank you guys so much for listening to this podcast. Please listen to the others. We are literally your one-stop shop for everything you need to service a dental practice in any capacity and make that bad boy run at optimal speed. So I will see you all on the next podcast of the Backstage Pass. Take care, everybody. Bye-bye.
Thank you, Elijah, and stay rad.
Stay rad.